Hello.
Good morning, Professor John Stephen. Hello and warm welcome to everyone for this 15th National Webinar on Medical Education, organized by Department of Medical Education, JIPMER, Puducherry. Myself, Dr. Mahapatra, Additional Professor and Head of Department of Plastic Surgery, will be working behind the scenes today. The topic of today's webinar is
Sir, you've been muted, sir.
Dr. Mahapatra, you're muted.
At the beginning, you can.
Yeah. Good morning, Professor John Stephen. Am I audible now? Sorry for the glitch.
Yes, you're audible now.
Good morning, sir. Hello and warm welcome to everyone on this 15th National Webinar on Medical Education, organized by Department of Medical Education, JIPMER, Puducherry. Myself, Dr. Mahapatra, Additional Professor and Head of Plastic Surgery. I will be working behind the scenes today. The topic for today's webinar is mentorship in medical education, which will be delivered by Professor John Stephen from St. John Medical College Hospital, Bangalore. Just to give a brief introduction on this topic for the participants, students in medical colleges are vulnerable to challenges of medical course, and mentoring programs are known to offer support and to acquire knowledge, attitude, and skills among medical students. Though there is largely no formal mentorship program in Indian medical schools, there is students imbibe characteristics from the role model as a part of hidden curriculum. This, however, is not optimal, and we have to ensure that the benefits of mentoring reach each and every student. Mentoring is a goal-driven process, and the success of any mentoring program depends on how it is structured and documented. Hence, there is a need for formal training to establish and operate mentorship programs in medical colleges and to achieve curricular objectives. Towards this goal, today's speaker, Dr. John Stephen, will share his thoughts and experience in mentoring in medical education. I'd like to give a brief introduction of our esteemed speaker today, Professor John Stephen. He is a professor in dermatology and medical education at St. John Medical College, Bangalore. He has been in practice for 20 years in clinical and teaching experience and 12 years of leadership in medical education. Now he's heading the Department of Medical Education at St. John Medical College, Bangalore. He was the former member of the WHO Guideline Development Group on common skin and oral opportunistic infection in children and adults. With this brief introduction, I would like to invite Professor John Stephen to start his presentation and request all the participants to put their questions in the chat box, which will be taken at the end of the presentation. Professor John Stephen, would you like to start?
Thank you, sir. Can you hear me?
Thank you very much, sir.
Okay, can I share my slides now? Yeah.
Yes, you can do it, sir.
Is the slides visible?
Yes, sir. The slides are visible, sir.
Okay, wonderful. Okay, so thank you, everybody, and special thanks to Dr. Jayaprakash and JIPMER Department of Medical Education for giving me this opportunity to participate in this program. And this basically, I put the first slide. This is my institution, St. John's Medical College in Bangalore. And mentoring, I've been particularly interested in mentoring for some time now. And in St. John's, we've had mentoring almost from the inception and from the 1970s. And they called it at that time guardianship. And we had when we did our MBBS in St. John's, each of us had a guardian, a senior faculty who was a guardian. And then over the years, we have tweaked it many times. And we do have a mentoring program at St. John's. And the medical education department here, we worked with HIV/AIDS and developed training programs for clinical mentoring, and done training with the WHO in Karur and Davangere, and also done programs in Kenya. So we've sort of dabbled with mentoring for some time now, and it certainly has been something very close to my heart, and really glad to participate in this program. So with this brief introduction, let me go straight to the session as such. Behind every successful man, there is a, usual thing is a woman, but for my session, I'll call it, between every successful man or a woman, there often is a mentor. If you close your eyes and look and think about all the successful people that you can think about, you'll usually find there is a mentor or a mentee relationship somewhere. I'll give you some, I'll take you through some examples here. There are many examples that we can go to. Oprah Winfrey and Maya Angelou, a very well-known relationship, a mentee-mentor relationship. And Oprah Winfrey openly has acknowledged this, that all her success is due to Maya Angelou. And you should read Maya Angelou, and some of the things that she says are wonderful. I picked up one thing that has always stayed in my heart, and it's wonderful. I tell this to my PGs when they start the course. And this is one of Maya's sayings, that's when you get, you give. When you learn, you teach. So I often tell this to my PGs, that teaching is part of your profession and your career. And of course, we know about Bill Gates and Warren and their relationship. But if you want to reflect on that particular relationship, both of them are successful. In fact, you would look to them as mentors, both each. Okay, the second richest man and the third richest man, but one is a mentee and one is a mentor. Again, the lines may blur. There are certain aspects for which Warren has acknowledged Bill to be responsible for the success, and vice versa. So mentorship and mentee goes both ways. So we could go many more examples. If you want to talk about Arjuna and Krishna, we can go again. There are many examples that we can think about. And of course, in our medical literature, in the history of medicine, the famous couple that we think of as William Osler, for us, the father of medical education as such, and Cushing, Harvey Cushing. Harvey was actually under Halsted, worked under Halsted as a surgeon, but Osler actually picked him out and brought him into his pack as such. And there's the stories of their relationship goes far. And in fact, there was a time when William Osler's son was treated by Cushing. And so there are many relationships that we can look at and about all the successful people. So what we're going to do in the next 40 minutes is sort of focus mostly on the what and the why. And I'm hoping that the how we can cover in the question time, because how to do mentoring is a biggish area. And I think it's very important, the what and the why. So we'll try and cover the what and the why in the first 40 minutes or so, and maybe have some time for questions where we can touch upon the how and those aspects as well. So what is mentoring? If you look into literature, there are many definitions for mentoring. I picked one, and it goes like this. Mentoring is a reciprocal relationship between an experienced, highly regarded, empathetic person, that's the mentor, and a less experienced junior faculty student member, the mentee, aimed at fostering the professional and personal development of the junior faculty student member. This is from the Standing Committee on Postgraduate Medical and Dental Education. Now, if you look at it, the words are I have sort of highlighted some words. If you look at it, the first thing that comes out in the definition is it's a reciprocal relationship. It's not a one-way traffic. There is a responsibility and duty of the mentee and the mentor, and it goes both ways. It cannot succeed with only one person attempting it. Both need to participate in that relationship. Otherwise, a mentoring or mentee-mentor relationship doesn't work. The second thing that comes out is it's basically between somebody who's experienced, highly regarded, empathetic person and a less experienced junior faculty student member. Now, that's how usually it works. But as you go along and the relationship between mentee and mentor carries on for some time, as in the example of Bill Gates and Warren, it can go both ways. Sometimes the mentor would be the highly experienced person. In some aspects, the mentee could also be, it could go both ways. Generally, there is somebody who has something to give, and there is somebody who has something to receive. And of course, it's not only about academic, it's about professional and personal development. That's what it is. So these are the important aspects of that definition. So the point basically is, it's not only just academic. That's what we tend to focus when we're talking about mentoring in the context of medical education. It also should involve the personal support and professional development. So what's the role of the mentor? It could be, should be a sounding board. A mentor should be a role model, a challenger, a career counselor, a developmental advisor, professional advisor, critical friend, facilitator, and we can go on. There are so many aspects that the mentor should be. But I think in one way for us to understand the concept of what a mentor is, one way to look at it is look at the negative. What a mentor is not about. A mentor is not about doing the mentee's work for them. A mentor or mentoring is not about supervision. It's not just trying to keep tab on what is the attendance, did the person come on time, and no, that's not mentoring. It's not about just filling the gaps as far as the skill deficits are concerned. It's not about treatment. It's not trying to solve the person's personal problem. That's not mentoring. So I think that when you start looking at what it is not, it gives you a different perspective to what mentoring is. But how is it similar to teaching? How does it relate to teaching? Maybe we can look at that as well. So I've given you some examples here, and we'll go through one at a time. And just to bring out that subtle difference between what a teacher is and what a mentor could be, okay? For example, let's take the first one. A teacher tells you to read a book, then tests you on your retention of the facts. On the other hand, a mentor reads a book with you, then discusses how the book changed you both. The second one, let's take the second one. Teacher often tells you important information. Mentor provides the opportunity for you to discover the information. Teacher understands his or her job to be that of educating. A mentor understands his or her job to be that of inspiring the students to educate themselves. Syllabus, yes, is planned as far as our teaching is concerned. But on the other hand, when it comes to mentoring, when we deal with our students, we have many moments where every moment you find these teaching moments, and in some, they will occur in some fashion, and that interaction is where a lot of the learning occurs. Fifth point, there is limitation in the amount of time that can be given to the student. In mentorship, there is no limitation. There is no limitation. It's very generous, and it can go beyond any the teaching hours. Teacher imparts the same information to each student equally. A mentor observes each student, makes suggestions based on their individual needs, passions, and skill. So I'm just giving you these sort of comparisons between a teacher and a mentor, just to bring out that subtle difference between a mentor and a teacher. It's quite possible that after reading through this, you may question and say, maybe as teachers, what we should do, what is written for mentors is what the teacher should be doing. But isn't that true actually? As we go from first MBBS, and then if we were to reflect on our interaction with our postgraduate students, we actually move from what is mentioned under teachers to what is mentioned under mentors. As we go further, and you will begin to lead a department, you're a senior in the department, you have junior faculty, you move. So it actually, it's sort of part of the same spectrum, but if you see, there is a subtle difference between a mentor and a teacher. In many ways, how we interact with our junior faculty, for example, could be the mentoring area. How we interact with the PG looks like what we should do. And so, yes, both may have some aspects of teaching, but how it is done is what's the difference. So there is this difference with what we conceptualize as a teacher and what we conceptualize as mentor. So if you look at it, there are lots of elements that we can discuss. There are many, many factors to discuss. What I'm going to do, is sort of discuss a few points that we can sort of reflect upon. And I think it's important for us to reflect upon these points to find mentoring important and also help in designing the program within our institution. So I put it as points to ponder. So we're going to talk about the unconscious bias. Is the glass half full? The helicopter view. It's not just encouragement. It's all about dreams. So these are the 5 points that we will talk about. Let's take the first one. Now, when we talk about clinical mentoring, there are many aspects that we discuss on that. But at the core of it, the essential thing that determines the success of clinical mentoring and the clinical mentoring program, at the heart of it is relationship building. It is the relationship building. It's the relationship that is the key factor for the success of mentoring. Without doubt, that is the most important factor. Now, that is at the heart, actually. It's at the heart of, if you can discuss about interactions, listening, many non-judgmental, many things are there. But at the heart of it all is relationship building and trust. Without relationship building and without trust, there will be no mentoring that will occur. So in this context, I want to talk to you about something called the unconscious bias. It's also called shortcuts. How long does it take for someone to form 11 opinions about you? Let's say you meet a new person and you just shake a hand. And how long does it take for you to form 11 opinions about the other person? And how long does it take for the other person to form 11 opinions about you? Studies have shown that if opinions take just 7 seconds, in 7 seconds, we've already passed judgment on so many aspects. The person is responsive. Oh, he looks knowledgeable. I think this is a friendly person. Looks like a credible person, empathetic. It occurs without even you thinking about it. It sort of occurs in the unconscious. Okay, you make a judgment call. We can say we sync with that person. Okay, we are on the same wavelength. It's a sixth sense. You call it what you want, but we do make these shortcuts. Or in 7 seconds, we do this. And this is a bias sometimes that comes in the way of relationship building. When you meet your mentees, it could be an undergraduate student, it could be a postgraduate student. All of us in the 7 second pass judgment on that. And very often there's a student in whom we sort of immediately sync and we think it's a wonderful thing. We don't mind having this relationship, mentor-mentorship, mentee relationship. But we pass judgment on many others and we don't feel like in some situations. There is a bias. It could be related to your power and equality. What I mean power and equality is sometimes mentor feels higher in the power or lower in the power. It could be cultural, it will be social. You may pass a judgment, on the competence. You find that the mentee is competent, not competent, dumb, smart, so there is a little bias so one of the things we should be aware of is that this bias exists. And quite often if this bias is there, this is the first stumbling block for the relationship building. I remember one of the examples that I can think of, I'm sure you'll relate to many examples of your own. And I remember in 1 year, we had a postgraduate who joined it, who had already married, had 2 kids. And after many years came and joined in as a postgraduate. And in my mind, I said, okay, looks like priorities are different. Their priorities were about setting up a family. And maybe this person's doing the course only for the sense of, I don't know what the sense is, how come so late? And I had already passed judgment. But looking back now, without doubt, I could say that that particular person was perhaps the best postgraduate student we ever had. And sometimes that happens. We do pass our judgments and that sort of hinders our relationship with them. So the other way, I often use this as another way to describe the same phenomenon. The glass, how we look at the glass as half full or half empty. And yes, it can relate to mentoring, but it could relate to any interaction, actually speaking. And the studies have shown that whenever you have an interaction, things, there may be, bad elements to that interaction, there may be good elements to it. When you begin to focus on the good elements, usually there's a lot of benefits to that. I'll give you some examples. Usual examples, let's say, for example, I go to the OPD. My OPD starts at 8:30. I'm there at 8:25. PG walks in. The postgraduate who's supposed to sit with me walks in at 9 o'clock. Now, there could be one of two responses here. One, you can say, how dare you? If I can come at 8:25, how dare you come at 9 o'clock? The other response could be, find out what happened first. Okay, maybe something happened. Maybe there was an accident. There's something, bike broke down. Some relevant things are there. In a lot of the things, we tend to immediately pass judgment, and then that kills the interaction, and that kills a further interaction. In mentoring, when you get a new person as a mentee, a lot of these judgments come in the way. So sometimes you look at the glass as being half empty, and sometimes you look at it saying, okay, there is potential here, so it interests you. So these are the biases that we go with. But remember, no glass is completely empty. Everybody, every mentee has something to give. There is something wonderful inside. We'll come to that story. This is an example from, I'm sure some of you would have heard about Ken Robinson. In one of his talks, I picked this up. I thought it's a wonderful thing. And he talks about this Death Valley in Nevada. And then this is the Death Valley. And he said that there's absolutely no rain in this particular area, and absolutely no vegetation. For years and years, there has been no vegetation at all, and no rain. And usually, insects and scorpions and snakes, those are what's known for this particular valley. But what happened supposedly was in 2002, there was 1 year where it rained. It rained for a few days, and heavy rain for a few days. And what happened, surprisingly, was in the next spring, this is what they found in the same valley. It was carpeted with flowers. So actually, that's what Ken Robinson talks about, and says that very often we tend to look at the glass as being empty. Okay, but if the opportunities are given, if the environment is positive, and if there is enough support, there is always something underneath there that you can nurture and bring out. And it is just waiting for this particular environment to blossom. And that is what the mentoring is all about. That being the experienced mentor having gone through life and having gone through this, to realization that that particular seed exists, and for you to give the confidence and the support and provide that particular environment for that particular seed to blossom. Okay, and that is what I meant by saying no glass is ever empty. We have to think about that, and if you look at what Roosevelt said, people don't care what you know until they know that you care. So the first point is that, it basically boils down to this. When we talk about mentorship, I think the first thing is about us, the mentors. Very often, the unconscious bias, the way we look at the glass being half full or half empty, the realization of the seed there in that barren land. This unconscious bias is what stands between a good mentorship relationship and no relationship. I remember participating as a mentor in St. John's. In the earlier days, till about 2 years back, mentoring students was always a voluntary activity. In St. John's, they asked faculty, would you be interested to be a mentor? And only if the faculty was interested, they were put into that roster, and a mentee allotted to them. And I have put up my hand more than once. And for the first 2-3 years, it never worked. And I think it's mostly because of the intention deficit. The first thing is, you should want to do it as a mentor. You should find value in that. You should think that you want to make that difference. If you just start a program as a mentor and that intention is not there for you to make that happen, it doesn't happen. Okay. So if you're indifferent, you're not passionate about it, you're very impersonal about it, apathetic about it now. So I find that if you look at perhaps the most common obstacle for a successful mentors program, I think this is this intention deficit. And I think this intention deficit actually comes from the unconscious bias. And we all have this bias. I think it's important for us, even before we even design a program, to reflect and acknowledge the fact that this exists. And we need to constantly remind ourselves that we need to go beyond this to make that mentorship a successful program. I told you, so relationship building and trust is the core. And for this, we have to remove those particular blocks, the intention deficit and the unconscious bias. There is a core within this actually. It is also very, very important. And that is you have to have something to give. If you're a mentor, you need to have something to give. For example, if you're a mentor in your own specialty, you're an orthopedician and you are a mentor, you should have knowledge, skill, experience. You should have something to give. Only if you are at that cutting edge can you be a mentor. So there is the inner core is actually your competence itself, right? You can talk about mentorship in research as well. I mean, you can't be doing a research mentorship without doing research. I mean, you should have done it and been there. And there is that is the inner core. And so we need to have that. So building this, without this, there's no mentorship is not going to work, right? So that is the core as well. Just sort of, I'm not dwelling on this point, but I do want to mention that within that, the fundamental core is actually your knowledge, skill, experience, and wisdom. So that's what we said. We talked about the unconscious bias. We talked about the glass being half full or half empty. I just want to touch upon this, something called, I'm calling it as the helicopter view. And this particular statement was made by Mike Pegg. He's also one of those corporate mentor programs and, trainer of great repute. And I just picked this up from one of the presentations. And he mentions great mentors provide a stimulating sanctuary in which people can take a helicopter view of their options. I think it's a wonderful thing. And if you look at it, the first thing that's important to note here is that it's a stimulating sanctuary. Now, stimulating means it's not just a conversation. It's not mentor-mentee doesn't mean it has to be inspiring, motivating. No, that's our word. The stimulating is there. It's a stimulating. And the second one that is very important is actually sanctuary. The mentee should feel safe. I mean, that's the thing that is going to be, you have to overpay. Let's say, for example, you have a mentorship program for an undergraduate course. You are going to be their senior teacher and you'll have students under you as mentees, but you have to build a relationship over a period of time because there is a particular way in which the students are going to be looking at you. But when you become a mentor, you have to make it, the relationship should be built so that they feel safe to talk about their issues. They talk about their challenges. They talk about their dreams. So it's not only should be inspiring, but you should provide a sanctuary. Sanctuary means a safe haven, okay? So it should be safe for them. They should feel safe to talk about anything they want without being judged. You should not be judgmental there. So that's the second one that's important in the statement. The third one is about the helicopter view. The mentor's job is to give the mentee, because the mentor has been there and done that before. So to give the mentee a helicopter view, overview of what are things to come, what are the obstacles that are there, what are the options that happen. I mean, that's the overall view, not a narrow view, a very broad overview. So about life, about career, about those things. So it's that view. And the fourth one that's very important is about not the mentor's options, but about the mentee's options. It's their options. So if you look at this particular statement, great mentors provide a stimulating sanctuary in which people can take a helicopter view of their options. So I thought this was a wonderful thing. So that's why I mentioned this as helicopter view. So not only should it be stimulating and inspiring, it should be provide that safe sense to talk about anything without being judged, have an overview of their options. Very often, it should not become like this. Mentoring is not about the mentee becoming more and more like the mentor. Yeah? And that's not mentoring. They'll start looking like the same mentor itself. Yeah, that's not the idea. The idea is to talk about the mentee's option, talk about how far the mentee can go and go beyond, and that's what mentoring is all about. So another area is about very often when you start a mentoring program, this usually happens, and there's a structure to a mentoring program. You meet with a mentee, and it becomes a fun thing to have a coffee together, a chat like that together. It becomes a social sort of meeting, getting to know. So you're focusing so much on building a relationship and trust. So, but mentoring is beyond that. Yes, relationship and trust, and not being judgmental, and the mentee beginning to trust the relationship, as the confidentiality of that, all that you have to work towards. Yes, but it's not just that. You have to provide that particular guidance, provide the environment for them to grow. It's about personal development. It's about, not only providing support, academic development and personal development. So there's a thing saying that we don't grow when things are easy. So it's not just a cozy meeting every 3 months. It's about beyond that. So if there is no action points at the end of the meeting, and there should be minor challenges along with the inspiration. So it usually comes together, isn't it? So usually the learning occurs from some sort of a balance between challenge and support. Okay, the challenge cannot be so much that it's overwhelming. On the other hand, you need that support, and mentors need to support their mentees, but challenge them too. It's not just about having a chat and being there for listening as a sounding board only. It's an active process, not a passive process. That's what I wanted to bring out here, that it's a sort of a balance between challenge and support. Okay, some of you will relate to this. This is Harry Potter, and we know here again, there was a mentor and a mentee relationship. Harry Potter was in a way mentored by Dumbledore. Of those who have seen the movie understand this relationship. I brought this only to introduce to you the Dementor. Okay, if there is a mentor, there is a Dementor. So remember this, that all mentors are role models, yes, but not all role models are mentors, right? So as a mentor, yes, we always talk that it's a positive thing, but in the mentorship relationship, it's not just about, yes, inspiring and providing support comes in. It's a wonderful thing to teach ethics, to teach professionalism. You are a role model for that. And in many ways, in the non-structured mentoring programs, the mentee chooses the mentor, And so it's important for you to realize your responsibility here, saying that it's not just being a good role model, but the bad elements will also have an impact on the mentee-mentor relationship and also have an impact on the learning. So it's not about just mentors, think about the mentors as well. This is about, as kids, don't we go back to being in school? Okay, and if you ask a child, I know what I wanted to be. I want to be an auto rickshaw driver at one point. So we all had dreams, isn't it? And as we went through life, in the third standard, you may have been wanting to be an auto rickshaw driver. As you went along, you wanted to be a pilot, and then the dreams changed. And that is one of the things about children. And as the situations arise, and you begin to change your dreams, right? But something happens in the teens, somewhere around the 10th standard, around even 9th standard, 10th standard, 11th standard. Suddenly the pressures begin, the reality hits you. And there is a sort of a point where you have to work in a particular way to go in a particular direction. There's only one direction. And children go through this pressure of parents maybe, okay, and your coaching classes, you have a NEET exam, and it's all about studying. It actually starts even in 9th standard, 10th standard. So the child has dreams, yes, but there's a lot of confusion that's occurring at that time. And there's only one thing that everybody pushes you to, and that is that you have to go for your tuition classes, you have to crack the NEET, and it's all about physics, chemistry, maths, biology, physics, chemistry, maths, biology. And this is what the child goes through for 2 years. And at the end of 2 years, they somehow manage and get into medicine, right? And get into medicine. That's where you meet them in first MBBS. And at that point, at first MBBS, they have done physics, chemistry, maths, biology for 2 years. And it's a relief that they just gotten and they just want to relax. And they're not thinking of anything in particular. They've already achieved, they've already come into MBBS. And it's a very confused state, that particular part of the adolescence. And it is here that they need that support. It's a very crucial time to provide that support in a way, right? And in the first and the second MBBS if you don't do that, they just go through life. We can relate this also to our postgraduate students. You can just go day in and day out, and just the question will be only about passing the exam. And that real passion for anything particular in that area is not there. And this is something where the mentor comes in. I always feel that the most important aspect of learning, actually, it comes in the environment that they're set in. And that's where the mentorship also is part of that environment. If you were to look at medical college students, people who pass out MBBS, or for that matter, even post-graduation, we know that if a person has finished from CMC Velo or St. John's or JIPMA, we know there is a little quality to that, right? But if you take school, for example, you can go to a convent school, you can go to a corporation school. The product that's coming out, in some way, we can relate to and say, okay, it's likely to be better in a particular situation. Even though the medical colleges, the MCI, or maybe the same university is the same curriculum, all of them take the same exams and go through this, pass out from the same university. There is a difference in the quality and difference in what they can think of. And that difference occurs because of the environment in which they grow. And one of the important parts of that environment in which they grow is about the mentorship. Okay, a lot of other things, the hidden curriculum and role modeling, but mentorship is one of those important areas which can have. So this sort of is, in a way, my last thought on mentoring. And I want to end with this particular aspect. Jim Carrey, and I think all of us know, and this is the Walk of Fame. And if you look at the Walk of Fame, he's written merrily, 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 merrily. And in one of the interviews, when he was asked about why did he write merrily, 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 he talked about saying that for him, the rhyme, the row, row, row your boat, was the rhyme that he really liked a lot. And he said that's very philosophical in a way. And if you all remember, row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. And that's what Jim Carrey says, that at the end of it, what matters is the dream. If you have a dream and you know that this is where you want to go, you just have to work towards it. The most important part is to have that dream. You need to have that dream and crystallize on that dream. Once you have the dream, you just have it, you move towards it, you labor towards it and find a path of reaching it. So as a mentor's job, actually, in a way, is to provide that dream for our students. whether it is undergraduates, postgraduates, it could be in any way, it could be research or otherwise, to give them that purpose, to give them that energy and that relevance to what they want to do, and inspire and motivate them. I think if at all, if there's one thing that we want to do, that's all that we need to do. In fact, our students who come into MBBS nowadays, information gathering is not a problem. They're far better at gathering information than us. I mean, now internet is there, you have everything on the net. Getting information is not an issue at all. It's about the dream. And I think in many ways, what the institutions do is nurture and build and shape dreams. I think as mentors, actually what we do is shape the dream for them and give them that dream. And that's what takes them to the next level. And that's what I think at the end of the day, that's what is mentorship all about. In order to do and provide that sort of thing, you need to have a conversation and a relationship with the mentee. And it's only then that all these things occur. And also, you have to be interested in doing it. Only then that will happen. So to end, I think we should be very careful and aware of the unconscious bias. I think I consciously do that now. I tell myself, I talk to myself and say, I shouldn't be biased. Okay, it's the relationship building, it's the trust building. That is the key to mentorship. Without doubt, without working towards relationship building, without working towards trust, no mentorship program is going to be successful. No glass is completely empty. Absolutely true. And the story of the Death Valley rings in my ear all the time. And I think it's very, very important to provide that environment and nurture your mentees, and they will achieve many things. Of course, the challenge versus support is another thing we talked about. Remember that it's not about just mentors, it's about dementors as well. But at the end of the day, we are as mentors, our job is shaping the dream. So let's enable to dream, enable our mentees to dream, facilitate the realization of their dream. That's what mentorship is about. Thank you. And I'm open to questions.
Thank you, Professor Stephen, for your illuminating presentation. We have some questions from the audience. I'll be reading out one by one. We'll be glad to get your answers.
Sure.
So the first question is from Dr. Himanshu. He's asking, what other resources can we refer for further exploring this topic?
Resources. Okay, the thing is, I do have some slides on that. There is enough literature, actually. If you look at, can I share my slides with that now for this? I'll just share my presentation.
Yes, you can share, sir.
Yeah. I think I had some slides here. Let me see if I have it. Okay. See, I looked at the data, I could give you a list, I can send you a list, but there are a lot of wonderful books and other things. But if you look at the work, this is a publication with regard to mentorship. Okay. Over the years, the numbers have increased. The studies on that have increased. Plenty of decrease. I actually had this and didn't want to include it because time was a problem. Is there evidence work about mentorship? And, there are, most of them are very cross-sectional and very descriptive. Most of the articles, there will be few systematic reviews are available. And these are two that I mentioned here. And the evidence is mostly limited, actually, in a way about whether, but there is enough evidence to say that it works. And the areas that it definitely improves motivation and encouragement, increase in research productivity, confidence in professional. And so it does have data on that. So literature wise, I don't have any particular book to talk about, but information and studies on this particular aspect been increasing over the years. And if you're talking about a specific thing, I don't seem to have a specific name for a book to read. Yeah.
Yes, sir. There is one more question, sir.
Yes.
Yes. Yeah. Okay. Is it a thin line between a good teacher and a mentor? This is asked by Dr. Radhika.
I agree with you. I think so, because I mentioned this when I talked about that table. When you start comparing a teacher's qualities and a mentor's qualities, sometimes you look back and say, actually, a good mentor is a good teacher as well. And I think that's what happens. The line is very thin. And as a mentor, there is a teaching, but mentorship goes a little beyond that, in the sense, when you are a professor and you have students under you, there's a certain responsibility and a duty for particular the class and for the curriculum. But mentorship goes beyond that, because there's also some things like conflict of interest. For example, if you're correcting the paper of that student and that student happens to be a mentee, there's a conflict of interest, because as a mentor, the relationship that you have with the students is a little different. You are non-judgmental. You want to help the student in whatever way you have. As a teacher, you're going to be absolutely impartial and give them the actual feedback, So there is that little bit of a conflict with this. So there's a subtle difference, yes. But in terms of, supporting them, yes, as a teacher also, we want to do that. Absolutely.
Thank you, sir. Dr. Tasneem has a comment to make. I think
Yes,
as a mentor, we should create equal opportunities to all our students in spite of their different school backgrounds. Then there is one more question. Do we have any formal training workshop for developing this aspect by Dr. Himanshu?
We have designed a workshop for mentoring. See, the thing, another aspect about mentoring that I did not touch upon. I mentioned briefly that in St. John's, initially we had something called the guardianship. Now, the guardianship was only because in St. John's at that time, St. John's was in the outskirts. Most of the students left their family and came and stayed in the hostel. So there was a guardian, a parent figure in the campus to go to. But later on, we shifted to clinical mentoring. Now, clinical mentoring and research mentoring is a little different from guardianship. Okay. Now, for example, I did mention about how we developed on-site mentoring for HIV/AIDS training. In on-site mentoring for HIV/AIDS training, we trained doctors and we provided the support for the doctors working in the field in clinical medicine, in clinical management of HIV/AIDS training. So when you're designing a mentorship program, like a research mentorship can be a little different design from a guardianship, and a clinical mentor design can be a little different. Even if I take the example of what's happening in St. John's, we have a mentorship program where all undergraduate students have a mentor, which they go through the entire 5 years. But in postgraduate students, few departments have mentors as well, okay, which they allot mentors. Sometimes it does happen that way. So in terms of training programs, if you're talking about clinical mentorship, we have a program that we have designed. But it depends on for what purpose you want the program designed. It has to be fit the purpose. Yeah.
Yes, sir. Then Dr. Joseph Philip Raj has a question. Is mentoring skill an inborn asset or can it be developed later?
Good question. I think Joseph is from St. John's, I think. Yeah. It is like I think it's a skill that can be, nobody is a born mentor. I agree with you. Absolutely. And it's something, and it's very important. There are studies to show that if a mentorship program is part of the program is training of the mentor and training of the mentees included in the program, there's a 90% success of mentorship program, successful 90%. If only the mentors are trained, it's supposed to be 50%. If there is no training of mentee and mentor, so the success rate is supposed to be 10%. There's one paper which actually discusses this issue, saying that training of mentors is if you're going to start a program, is absolutely essential.
Yes, sir. And Dr. Ravindra Inamdar is asking
Yes.
how to do this for UG 150 numbers.
So I'll tell you, I suppose it has to be something that you have to internally discuss and see that everybody agrees with it. But I'll tell you what we follow in St. John's. What we have done is that we had taken 50 faculty every year. For example, year one, 50 faculty, we have 150 students. Each faculty gets 3 students, right? So I'm from year one, I get 3 students. And then the next year, the next 50 faculty get in. They get 3 students from the next batch. And the following year, another 50 faculty. So I get another set of 3 students on the 4th year. So at a point in time, I will have 6 students under me, 3 senior students and 3 junior students. That's how we go. And I think there's no hard and fast rule about this. It depends upon your logistic requirements, and you have to design it. And initially, we did have a program where people said the preclinical departments are in constant contact with the students, so the mentor should be only from the preclinical departments. And we found, and we did that, and we had mentors from paraclinical in the second year, mentors from the clinical group in the final years, but didn't really work, because for mentorship and relationship to work, it needs time. Relationship building doesn't occur with 2 meetings. When you have the same student with you for 5 years, there is a relationship that does build. But if you're going to meet for 2 times and expect a trust and relationship to occur, it doesn't occur.
Definitely, sir. Dr. Shamana Shirin is asking, how frequently should a mentor and mentee meet? And should it be individually or in a group?
No, that is a good question. The recommended is at least once every 2 months they should meet, and it should be a program, because we are not talking about a mentorship program that occurs voluntarily. We're talking about an organized program. There should be a structure program. Only then can things begin to happen. If you let it loose and you don't put a structure in, very often there may be 2 or 3 success stories, and that's all. It just falls apart. I think at least there is one particular place where they've actually mentioned there should be at least once in 2 months they should meet. So there should not only meet, it's also good to have some sort of structure to that. You meet, maybe you can plan on what you want to discuss. Then there could be some sort of a reflection that you say, okay, this is what we discussed. And in the next meeting, there should be an action plan. If you don't have an activity tagged, a planned activity that you're going to say, okay, by next meeting, we shall do this, we work towards this. If you don't have that action point, then it becomes just a social meeting. Social meetings can also help in the relationship building, but it cannot be only that. There should be something beyond that. So I think maybe at least once in 2 months, even if it's once in 3 months, it's fine, but it should be a structured program that will help, especially because most of us are not really used to having this mentoring program in our institutions.
Yes, sir. Then Dr. Raja Jaya Kumar is asking role of ethics on mentor and mentee program.
Any particular ethics, any particular questions? Like seeing as, because I'm not too sure. See, ethics is something that you can learn in that program, in the mentorship program. I don't know if you're talking about, ethics in terms of being the teacher and the mentor, or is it to do with gender-related things? Any specific question that we have in that ethics, I'd be happy to hear that.
Yes, sir. Then there is one question from again Dr. Joseph Philip Raj. How do you evaluate mentorship program in your institution, and how often it is done?
No, we at the moment we don't have anything for. We evaluate the process as of now. In the sense, we make sure we want to know how many faculty have actually met. How many times have they met at all? Is it happening at all? We have to start looking at capturing the outcome, and we haven't done that yet. In terms of maybe when the students leave to capture what happened, what worked well, what are the challenges. We haven't evaluated that. As of now, we are evaluating only the process to find out. And we have a meeting, periodic meeting of the mentors, because there are challenges that the mentors come across, and it's good to share their experiences with our experiences, share between mentors. So we have a sharing sort of a thing that occurs once in 6 months. And we just monitor how often they've met and how many have met and how many have not met, and that sort of stuff.
Yes, sir. Dr. Vijisha Falgunan is asking, where do we fit mentoring in our curriculum?
Mentoring will be not so much for teaching the curriculum. It's for beyond that. It's not really tagged to the curriculum that way. It's in addition to the curriculum of sorts. It's outside that time. It's not inside the curriculum time.
Right, sir. Dr. Nalini is asking, who qualifies to be a mentor? And in a medical college with so many UG, PG students, all junior staffs are mentors, when they themselves probably need a mentor. That's a comment.
Absolutely, you're absolutely right. That's a good question. In fact, in the discussion, this is how we went about our thought process. And we said, if we don't start now, as of now, associate profs and professors are included as mentors in our institution, right? But I'm saying if the assistant professors and the junior faculty don't get involved with this, after 5 years, after 6 years, after 10 years, even if they didn't do mentoring properly in the initial years, they have to build their own experience. How do they build their experience? They have to build the experience by being a mentor. So only if mentorship is part of regular faculty culture can, at some stage, they will have that experience. So if we begin to start only, so we are saying that we will in fact want to include assistant professors onwards, so that after 3-4 years, maybe the first year is tough, we don't know, we also want to learn. But as you become senior, you actually done mentorship 3-4 years and you begin to learn and share that experience. So there is no other shortcut. You have to start somewhere. So we initially started with including only associate professors and professors. Now we are including assistant professors also into the pool.
Yes, sir. So Dr. Kavita is asking, can you suggest ways of becoming a role model?
Oh, I don't know. Role model, I don't know. See, I'll tell you another way to example this. For postgraduate teaching, okay. I'm the vice dean for postgraduate teaching. So I could focus on logbook, okay. I could focus and design a beautiful logbook. I can focus and design beautiful curriculum. But I'm thinking, and this is what we're going by here, we're saying if for example, if we can build a department, imagine a department where they have 3 major grants, NIH studies going on. They're doing, 100 surgeries going on, multiple busy state-of-the-art work going on. And, the number of patients they see is so many. In a situation like that, if you put a PG in, they will learn. There's role modeling there. People are doing research, people are doing wonderful surgeries, how all that is happening. But instead of that, imagine another situation where there's hardly any surgeries being done, no research happening. You have 3 faculty in the whole department. You put a PG there. So I think in terms of provide, especially for postgraduate training, you need to have a wonderful environment there. If you can build that environment, and I think that's what we have to focus on, you don't need a logbook and other things, So in a role model, you have to be, if you want to teach them about research, you have to role model research. You teach them professionalism, you have to be a professional. If you're taking money on the sly, you're coming late, that is a different mentoring. Yeah.
Yes. Then, sir, there is one question. Dr. Vasavi is asking, sir, in mentor and mentee program, is the mentor same throughout the MBBS for a mentee?
Yes, the thing is, that's a good question. I told you, we have experimented with it. We had initially, there was a thought, the faculty thought it's good to have, because the anatomy, biochemistry teachers don't connect with the students after they go and become in the final year. There's a thought that they should be mentors only for that group. That didn't work. I told you, because relationship building takes time. Now what we have is that the mentees are with me as a faculty for the entire 5 years. And even beyond. Quite a few of them will keep in touch with you even after, and some come back and join PG course. Even some of them have gone abroad, they'll keep touching with you. It depends on the type of relationship that you have with them. So for the 5 years, the question is the mentee going to be the same faculty for the 5 years? Yes. Yes. As of now, that's the structure we have.
Yeah. There is one question from Dr. Sumanar. Can we undergo training in mentorship? If yes, what, where, how?
Okay, I don't know of any formal training programs here, but we do have one program in St. John's. I don't know if you people have JIPMA. I don't know if have a particular program in that, and I don't know of that. I don't know if there's any particular program already available like that. But anyway, JIPMA is a center to start it off. Yeah.
No, we also
its strengths are there.
Maybe we can start something.
Sure.
Yeah. So again, Dr. Joseph Philip Raj is asking, how do you envisage mentoring or guiding postgraduate students who are already grown-up adults?
No, particularly because they are adults, and like somebody earlier mentioned about the thin line between teaching and mentoring, particularly because they are adults, you can't teach the adults like we teach school people, right? I mean, it's all about providing the environment. It's about more towards mentoring, right? So you have to provide the opportunity, provide the environment, give them the reason to learn, and they will learn, and provide that opportunity. I think for postgraduates particularly, in a way, we all do that in a way. We are already doing it. Maybe we're not calling it that. We actually do more mentoring than classroom-based teaching. We guide and support and that sort of a thing. I think it's more, that's how most of our teaching actually even now is occurring.
Yes, sir. So Dr. Swati is asking, many students come to us with their personal issues in a mentor-mentee relationship. What are the limitations in such situations?
No, that's a good point, because sometimes you cannot play the role of the parent, or you cannot play the role of a psychiatrist. Sometimes even that occurs. Okay, so those are the lines that you have to understand. Okay, beyond a point, those are things that it is sort of there's no hard and fast rule about it, but those are the lines that you have to understand. At a certain point, there's things that you have to get. There's a confidentiality area as well, because if you don't have confidentiality, the student will not trust you, and that sort of environment it won't work. That whole purpose is for the student having a problem to come to you. If the student feels that you're going to talk about it and be judgmental, they're not going to come to you. On the other hand, beyond a point, you do have to bring in the parents, and beyond a point, you have to perhaps bring in the dean or the psychiatrist. I don't know. It depends on the situation. We do have to draw the lines, yes.
Yes, sir. Then, sir, should the mentor, this question is from Anusuya Ghosh, should the mentor provide advice and suggestions only when the mentee is willing to get the feedback?
No, that's the thing is, it's not so much advice or suggestions, it's about, there is no suggestions, and I think there should not be much advice that way. For example, if you're talking about what will be the best way, whether to go US or whether to go stay in India for further studies, I mean, you're not going to tell them this is a better way to go about it. You're going to tell them what the situation is, allow them to think about it, and make them make the decision. But you will provide them all the roadblocks. You will provide them the picture. You will provide them what are the paths available. You will tell them, a helicopter view of what is available. Right. Okay, you provide that, but make the decision has to come from them, right? So if the person comes to you, yes, you have to provide, because you have been there, you've done it, so you know what the roadblocks are, what are the things. So that's how it will be. Not so much as saying, this is the best thing for you. Okay. Maybe there are situations where that also can occur. Maybe because you're a senior person, your wisdom tells you, I think you take this line. You are very good at this. Maybe this will work for you. It will happen. I'm not putting a blanket on anything. But generally speaking, I think we are going to sort of provide them an overview, tell them all the paths available, talk to them about the roadblocks, and they will take call on what they think is right. But I agree, sometimes we may also say, I think I've seen people in the past, you are wonderful, I think this is the line for you, I think you should go for it. And there are times when we may say that as well. I suppose it has to be individualized.
Yes, sir. Then Dr. Jarina is asking, does mentor-mentee ratio in medical college affect the outcomes of mentorship programs?
Oh, in some ways it will. I suppose you can't have 20 mentees under you, right? I mean, it's a little too much to have, because you can't give that much time and effort to that. Relationship building can be tough. So on the other hand, 1 or 2 or 3 mentees won't make a difference. I think that's okay. So I guess if the numbers are too much, it will be a problem. But I think around what used to happen, St. John's, we used to have only 60 students at a time. There was a time where 1 person per year made it 5 students under you. That was comfortable. I think 5 to 10 will be comfortable. One more thing that happens actually when you have people of different, different years coming into the mentee group, when you meet as a group, there's peer mentoring as well. The final year student will provide support for a first year student, There's that sort of a mix also sometimes works well. It's not just only the mentor that has to provide the support, okay? It could be a senior person providing the support as well.
Right, sir. Dr. Rajesh is asking, how can we assess mentoring will be effective?
Okay. It depends on, see, for example, if you're talking about research mentoring, I'll tell you. I'm looking at the literature that I've read. When you talk about research mentoring, they're very clear. One of the factors I looked at is the amount of research done itself, with mentoring and without mentoring. So if your objective was to increase the number of research being done, then you can check whether the objective was reached. In the same way, if you're talking about undergraduate mentoring, if your objective of that is in terms of trying to see outcome, like, the success in exams, or then you can look at that particular factor. We haven't really done that here in St. John's, I told you in the beginning, but depending on but some things, it's very difficult to assess. It has to be some sort of a focal group discussion at the end of the mentorship program to talk about. It must be a very, qualitative sort of a study rather than a quantitative study.
Right, sir. Dr. Jayaprakash Rajan from our medical education here, he's asking one question. Are there any strategies for documenting mentor-mentee relationship and the outcomes of mentorship program? He also has added one more question: how to eliminate bias in selecting mentor-mentee?
There is I don't know how the bias will be there, sir, because we are just randomly allotting students to mentees. One of the constant questions that come to us is that many faculty feel that with some students, they're not able to gel. They're not of the same wavelength. It's not working out, okay? Now, that is where the mentorship training has to come in, okay? And there's a feeling that when you start mentor-mentee relationship, when you start the program, there's a feeling that you have to gel and sync in the first meeting. It may not happen. That's where your intention of being a mentor comes in. Okay, in a program in a medical college setup, when you're setting up a mentorship program, you may land up with a student, and that's what I talked about. The first point I talked about is the unconscious bias. It's a lot of bias that we have, depending on, from cultural backgrounds to, so many things. Certain students we gel with, we are in sync with, certain students don't sync or gel with us. Now, but if the moment you start to practice it and you take the unconscious, the bias out of it, and you give time for a relationship to build, and it does. So what we do here is we encourage them not to give up on anybody and to try it out further. But there will be a point at, say, after a couple of years, it's not happening. Yes, I think it's okay to change a mentor or mentee. That is also allowed. And I think it should be allowed, because sometimes it may not work and it should be allowed. But on the other hand, you cannot give it up in the first shot. You have to, because it's not going to work like that for everybody. You know, if that was the case, then the only way it will work is voluntary choices.
Yes, sir. And part of the question was any strategies for documenting mentor-mentee relationship and the outcome.
So the thing is, as of now, we do have a thing of documenting the process, and we have something about reflections on what happened during that meeting and the action points. That's what we're documenting. We haven't documented, only the process is being documented. Right. Outcomes we haven't designed, but I suppose outcomes are going to be more qualitative rather than quantitative, unless we look at, you know, publications and pass percentage, attendance and things like that.
Yes, sir. There is one question from Dr. Manjunatha. Rarely we get more enrichment in question and answer time than the presentation. Yes, this is one such session which he has a comment. This is one such session which demonstrated how a session can truly address the participants' need. Thank you, sir. They're appreciating the discussion, but that's good.
Okay. Okay. Thanks. Thank you.
Yes, sir. So there are a lot of positive comments. Most of the participants liked the presentation. And for the participants, those who are interested, we skipped some questions due to the interest of time. Participants who wish to connect with Professor John Stephen, the email is given in the chat. Sure. They may send an email to you, so you can. Sir, with this, I will come towards the end. I'll give a concluding remarks of your excellent presentation today. It was actually very illuminating. Professor John Stephen started with the definition, the roles, mentor play, and the difference between teachers and mentors. And one of the important things was how in the steps of being a mentor, how we remove biases in accepting a mentee. The example of Death Valley, that no glass is ever empty, has to be kept in mind. This is something very crucial and very important. Then personal development in the face of challenges and adopting this principle in mentee development. This is one very good take-home message from Professor John Stephen's presentation. And in addition, trust building, which is a slow and steady process, and which is important in the whole mentor-mentee relationship. Thank you again, sir, Professor Stephen, for your excellent presentation and the excellent discussion which we had at the end with active participation from the audience. Thank you very much, sir.
Thank you. Thank you. Thank you for the opportunity. Thank you so much.
Thank you. We'll close.
Sure.